Welcome to Where Parents Talk. My name is Lianne Castelino. Our topic today is about a health condition that has been found to affect 1 in 5 children and youth. Often underdiagnosed and inadequately treated, complex or chronic pain is described by health professionals as a growing epidemic, hitting girls particularly hard. If undertreated, the condition can lead to disability, mental health, and even socioeconomic challenges. The Montreal Children's Hospital is considered a world leader in the area of complex pain. It recently received a $5 million donation to expand research, treatment, and support for children and teens suffering with recurring persistent pain. Joining us to discuss complex pain today is Rebecca Pitt, a clinical nurse and a mother of 3, as well as Bethany Frank, who is a social worker, and both of them are with Montreal Children's Hospital. Thank you so much for being here today.
Thank you for the opportunity.
Rebecca, I wanted to start with you. Many of our listeners and viewers may not be aware of exactly what complex pain entails. Could you define it for us?
Yeah, so we usually talk about complex pain as being pain that's going on beyond an expectable timeline. So I think in the literature, it's often been discussed as pain that's going on longer than 3 months, but we've gotten a little more, I think, flexible with that definition that can even be shorter than 3 months. But if it's, sort of a healing process that doesn't seem to be following its regular course, and yet everything's looking okay, but the patient still has pain, the person still has pain, then at that point we start to ask, is there something else that's going on? But I would say there's also a second part of complex pain that is important to keep in mind. And that has to do with how much the pain is impacting the child's life. So you could say, my child is missing, a day or 2 a week at school, or because of the pain, or my child's sort of, isolating from his or her friends. I mean, we're in the time of COVID where that's happening anyway, but it's going above and beyond what the restrictions right now are, or they're sort of retreating from their sport or not participating in gym class. Those are other sort of red flags that we would say might be, leaning us towards a definition of complex pain.
So when we look at the definition and then ask, how does this manifest itself? How would you go about trying to explain that to a parent or somebody who's not familiar with the various ways that this can show up?
Yeah, so probably a helpful way to talk about that is the different things, the different ways that we see complex pain here. So the different diagnoses that we see. So we would see kids showing up with headache. It could be post-concussion headache, or it could be just ongoing headache or migraines. We could see a what we call chronic musculoskeletal pain. It could be athletes who are involved in a sport and might have ongoing shoulder pain or knee pain that's starting to have an impact on their sport. It could be also chronic abdominal pain with associated symptoms or not. Could be joint pain, could be disease-related pain. And so again, it's keeping in mind how much this is impacting their lives. We can see athletes who can motor through some serious training and we know they have pain. And by the way, that's one thing that we are very sure to tell our patients when they arrive, is that we believe they have pain and we're just trying to figure out how to help them. So they're having pain, and it's, these athletes, they're able to just keep on going. Whereas we see other children who might come in and they seem to not be able to function at all. So we really look at the impacts as well. And finally, coupled with the goals that the patients have. So I know it sounds like a bit of a stretch in answering your question that we're talking about how it manifests itself, but it's so individual. And we have patients who might seem to present in our clinic who really don't need to see us because they're functioning so well, and others who may not seem to have such a high degree of pain, but they're really not functioning well at all. it's, you know, it's really variable. All of them have pain and all of them need help. And that's our job to figure out how to do that.
It's interesting because, I mean, as you've described it, there are so many factors that can potentially contribute. So if you're a parent and you've got this sort of this broad definition that you're working with, you know, recurring pain over, you know, 3 months or more, that kind of thing, like, what would you say to parents about at what point they would need to require intervention for their child?
Right. Well, I think, you know, with that, I'd like to always have a starting point of saying there are a lot of really great primary care practitioners out there who are really good at figuring out, okay, we've got an injury or we've got a child who's presenting with these symptoms. These are the tests that need to be done or the physical exam that needs to be done. And this is what needs to be done. That's a really great thing. That's the thing that we're really trying to do better, to equip primary care practitioners to be able to treat well, so that parents can trust their primary care practitioners. And, you know, I always say treatment of chronic pain is not rocket science. There's nothing like, you know, it's not cardiovascular surgery. It's nothing like that. But if it's not done right, the repercussions can be so severe. So equipping our primary care practitioners so that parents can trust, I think, can then help us to answer that question and say, just, you know, you can go to your primary care practitioner and trust that they are going through the right thing, the right ways. If they are doing the right things, then I think you need to trust your parent sense. Your parent knows. That's incredible that you know, we all know that parents are dealing every day with new situations that are coming up with their kids that are super challenging, whether they're social situations or physical situations or you know, psychological situations. And parents are the best at identifying, oh, something's not quite right. So, you know, I think having the knowledge that, okay, when you have a sprained ankle, this is the usual course of healing that we can expect, which your primary care practitioner can help you with, coupled with that parental sense of there's something not quite right here, is, you know, we want to make parents really confident in their judgment, you know, to be able to manage this. We certainly don't want parents starting to look for complex pain. That's my thing, is worrying about, like, if we're drawing too much attention to it, it's not so that you'll be looking for it. It's so that if it happens, you'll know how to identify it. I don't know whether it's a subtle difference, it's nuanced, but I think it's important.
Bethany, I want to turn to you and ask you for your perspective on that point. When you see parents and they have questions or you're providing them support, like, what are some of the things that strike you about what you hear them share with you?
Yeah, well, I think, you know, something that ends up happening very often, we see pretty frequently, is families will come to our clinic after sometimes several years of having a child that's had a complex pain issue. And they present to us really with a myriad of emotions. They can feel frustrated, they can feel mistrusting, they can feel hopeful, they can feel doubtful, sometimes even pessimistic about the outcomes, just because it's been such a long road to get to this point. And a part of what we do kind of in welcoming them is just normalizing that there are so many emotions that comes with it. I think, as Rebecca said, it is important for us to be able to identify this spectrum between minimizing and dismissing a pain issue that does need to be treated, but also not going to this other end, which we call catastrophizing, which is essentially really thinking about the absolute worst case scenario. And parents have access to the internet, they have access to databases and research. And so there is a lot of information available on complex pain issues in children, but it's not to say that it's the same for every child. And so we have to really help walk them alongside, you know, in this area, because we know that there are some negative impacts if we do go to that end of catastrophizing, where they think this is a lifelong issue, it's never going to get better. So it's always looking at, you know, how is the family dealing with this, and how can we make sure that it's being dealt with in an appropriate way.
On that note, in what specific ways does the clinic and then the support group that I understand the two of you have recently founded, how does that help parents support their children who may be diagnosed with complex pain?
We're super lucky, blessed really through the Louise and Alan Edwards Foundation, who've pledged to give this $5 million gift. It's allowed us to transition from a chronic pain service to really specializing to a center now on complex pain. And so what we've done recently is we've changed the name of our service to the Edward Family Interdisciplinary Center for Pediatric Complex Pain. And through that, it has allowed us to expand the services that we can offer to families. So when we use this word interdisciplinary, it's a fancy term basically to say that we are not just a medical service, but there's, definitely anesthesiologists, physicians that have specialized in pain. We're a teaching hospital, so we also have medical fellows. We have medical students on our team. We have psychology residents, psychology, students. Myself as a social worker, Rebecca and nursing staff, physical therapy. So all of us together really try to brainstorm, how do we give a holistic treatment plan? And the parents are, like in any branch of pediatric, medical care, partners with us. And so, of course, we look at the patient and their family as the patient themselves, but we try to ally and join with parents because they do end up, putting into practice what we're trying to teach the kids at the hospital. And it's become really interesting now being able to do that this year with COVID virtually, because we get to see the home life, right? We get to see a sphere of the work that before was just not existent. And so my work as a social worker is really, I've got two veins. I'm dealing with the parent kind of family system, and I'm also dealing with the school system, which is a whole kind of other section of the work that we do. So to support parents, we want to make sure, we're assessing how is the family reacting to this. There's a grief process that's involved with having a child that has a chronic medical condition, because it does flip your life upside down. It flips the family home. It's very turbulent. One parent might be having one reaction, the other parent might have a complete different reaction, and we have to be able to contain that and manage that. Siblings also, you have a sibling that's coming to the hospital very often. They have their own kind of responses to what's going on. So we're looking at that. We're trying to coach families to be able to make sure that the child is what Rebecca described before as functional. And so when we're looking at trying to regain function in a child, it's getting them to come back to some sense of normalcy over their lives pre either the injury or infection, or sometimes pain comes out of the blue. So it's encouraging parents to have their children participate in normal everyday activities again, to not avoid going to school, to being able to, slowly go back to a sports team. Even just simple things like we wouldn't think about, like going to the mall with your friends, that involves a lot of walking. So it seems like something that's pretty mundane, but those are some really tall tasks for some of our patients. So we want them at the end of the day to just be having fulfilling and meaningful lives. And we do expect that the pain with this kind of multidisciplinary treatment does go down, but our primary goal is for the function. Through this donation, we've been able to expand our services to have this parent support group. And so what it is it's a 6-week group. We offer the same thing to our adolescent clientele through our psychology team, but now we have this new service for parents, and it's very exciting because, like I said, we need to support them just as much and sometimes even more than our patients, depending on the situation. So in the group, we cover many different topics. What is it like to communicate with your child who has a pain issue? Kids communicate in very different ways. Some kind of internalize, they don't talk about it. Others, are very expressive. We're coaching parents on concrete strategies to get their kids moving, how to get them to school, how do parents partner with schools to make sure that kids are on track and they're not being penalized for missing for medical appointments. How do we make sure that kids are moving at home and engaging in physio, which can be painful. And so that's a tricky part. I think one of the most exciting parts of this parent group, which now we've been able to offer in both English and French, is this sense of just camaraderie amongst the parents. Even though we know that many children and adults have complex pain issues, they don't get to really see each other. And so to have a space where they can talk and one person will say something and 5 others will say, I felt exactly like that. It is quite powerful. We are seeing the power of just a shared community. And with COVID, we're running it online. But even at that, it's just been really, really amazing to see just such close bonds being formed and a lot of instrumental learning in the process.
Rebecca, I want to go back to you and pick up on a couple of points that Bethany just brought up, but one of them has to do with, are there specific parts of the body that are affected by complex pain, the condition, more than other parts of the body?
I mean, it's a very good question. We know that abdominal pain is very common, headache is very common. In our active population, athletes, it would be more, joints and extremities that they're using more in their sport. We know that definitely sport these days, probably compared to 20 years ago, kids who are doing sports, if they're doing swimming, they're specializing in a certain stroke and in a certain distance in that stroke. And so there are certain muscles, certain parts of their body that are being used exponentially more than others, probably in a much less balanced way than 20 years ago, where you would have had an athlete who was a little more flexible in their events. So I think that definitely for athletes, you have sort of the wear and tear kind of injuries from too much of one thing. But I'm just trying to think of anything else. I think that headache and abdominal pain probably account for and musculoskeletal pain would account for the bulk of the sort of 20 to 25%, which is the prevalence of chronic pain in pediatrics here, So, and I think, if I'm to go back pain definitely is a big one, as it is with adults, but with children as well. We know that COVID, with the prolonged sitting, with virtual schooling, with kids not moving around as much, that's been a big problem, is back pain. And then also, I mean, I think the causes, we could go into them, but COVID has been a real struggle for our patients. Also from a stress point of view, typically they responded really well at the beginning because they got to do or not have to do school, or they got to do school at home virtually. They didn't have to get out of bed as early. They didn't have to deal with social anxiety, which a lot of our patients struggle with their friends, performance anxiety. A lot of our patients are really high performers, and there's a lot of stress around school performance. And so all of that was a little bit down. And so at the beginning, they were all doing quite well, and then all of a sudden, boom, the stress, the mental health impacts, depression, anxiety, then the uncertainty, return to school, everything like that. Seeing a lot of patients who might have had one pain who now have, widespread pains, or abdominal pains, could be related, or headaches related to stress and related to increased screen time. So, yeah.
Can you give us a sense, as I understand it, in looking at some of the research, that it generally affects girls more than boys? Do we know, does the research show why complex pain tends to affect girls more than boys?
Yeah, I mean, Bethany and I were talking about this right before. I think in the literature, it actually says that boys are, before puberty, boys are more affected than girls. And then it's post-puberty that girls are vastly more affected than boys. So, you know, from our clinical experience, we certainly, post-menstrual girls are more at risk of pain, and often it can be increased when they're menstruating, which is really difficult for them because it's a very frequent occurrence. But it's an inflammatory process in the body, which when you have an inflammatory process in the body, whether it's an infection or an allergic reaction or your period, your regular pains will go up. So there's definitely that link, hormonal link. But then if we look at the impacts, because I think, when we see just vastly more girls than boys. I'm not an expert in the studies in this, but I would say that the impacts on girls of just the different things that we talked about, social isolation and not being able to do the things with their friends that they want to do. It seems that maybe the outlets are less and that the impacts are then greater on mental health. Now that's not research based, but I think that probably there's an element of the impact that would finally bring them to a chronic pain service like ours. And that actually there are a lot of boys out there who might be feeling pain, who are just, who are just not seeing the impacts until they're a lot more serious. So this is by no means saying that boys are less likely to have chronic pain or that boys are somehow, better able to tolerate the pain or anything at all. And I think it's really important to remain attuned to your boys as well. Boys are spending a lot more time on screens too, and it's really important that we see what's going on with them, that we listen to them, because generally speaking, by the time boys come to us, things are a lot more serious. And so it's just a bit of a plug for just looking after your boys too.
Yeah, no, and as a mother yourself, you see that firsthand for sure. Can I ask you, why is complex pain being looked at as a global epidemic? I mean, when you use the word epidemic, everybody's ears sharpen because you're talking about, something that's on the rise. Why is that?
Yeah, I mean, I think that it's probably, there are two aspects to it. I think there's one that it's been under-recognized. And so now that people are realizing that it's, how many people it affects, we realize how widespread it is. And that, when you talk about 25% of a population, that's a lot of people, a lot of kids. So there's that aspect, the prevalence, but I think there's also the impact. So when we talk about, say, in the States, the primary cause of work disability is the diagnosis of fibromyalgia, for instance. Now, fibromyalgia is a diagnosis that we tend to stay away from, or at least a nomenclature that we tend to stay away from because we don't find it particularly helpful for the patient, and we find that it has a lot of baggage with it because of the impacts. But when we think about the impacts of chronic pain, whether it's back pain, whether it's widespread pain, which we tend to call it more that, headache on populations. So in kids, that would be school missing, that would be social isolation and mental health impacts like anxiety and depression. That would be just increased ER visits, all that kind of stuff. The impacts and the cost to our medical system is huge. And I think that's why, I really want to give a plug for primary care practitioners here. They do a wonderful job and they have a really hard job. We're a hugely specialized service with a lot of supports. And primary care practitioners are often out there on their own. I've done a lot of training with them and seeing their questions, hearing their questions. They have to do the whole interdisciplinary thing, or at least identify which parts of it are most needed. So we're really looking, and this is another thing that we've been able to hire another nurse because of, we're in the process of doing so because of this grant from Jane Edwards and Eric Cogier. And I think, that's going to allow us to focus more on equipping primary care practitioners to be able to manage this, because certainly we as a complex pain service are very proud of what we do and we value it so much, but we can't serve the whole population. And if we are talking about, as you say, a global epidemic, which is, I know, the word that I think Dr. Angelmo used, then we need to spread out a bit, and that means to primary care practitioners, that means to schools, helping school administrators understand better how to manage kids who might be missing school, and they look at the child and they don't see anything. It's not like having a diagnosis where you actually see, you see the illness. That can bring along a lot of stigma, and so a lot of it is education that we want to get out there and just equip others to be able to manage this really important problem.
Bethany, I want to ask you, as we talk about impacts, you both have mentioned quite a few of them, but what are some of the more extreme or long-term impacts down the road that could happen to an individual, a child, as they grow into adults from complex pain that is either, not diagnosed or undertreated? What are some of those impacts and what do they look like?
Yeah, so I think what we're talking about here is a term that we call dysfunctional impairment. It's a concept that we teach in our parent group. And so what we define that as is children that do not have proper supports that are put into place or don't accept proper supports that are put into place to treat the chronic pain issues and the complex pain issues. It can lead to school absenteeism, that can lead to failing, dropping out. Because of that, they can end up not being able to work, being kind of on permanent disability, not moving. When kids are not moving, they become more stiff. And so any slight movement, like sweeping, becomes like an enormous, painful event. And so that to us is super concerning, because we don't want them to get to that point of disability where they aren't really able to live normal, kind of happy lives. I think to Rebecca's point, complex pain is like any chronic medical condition, but especially this one, because mood and pain are joined. So we do see that there are a lot of, in psychiatry, the term internalizing disorders, which is depression, anxiety, mood issues. And so we can see that there might be a higher prevalence for needing psychiatry involvement, where kids are upset and they might start to feel, depressed, suicidal, suicide attempts. That's very serious for us. And we need to work in collaboration with our Department of Psychiatry at the hospital, which we do. And so those are some of the kind of big red flags that we're trying to prevent. And the beauty of pediatrics is that we do have the opportunity to stop, to get to a standstill and say, okay, let's stop here and try to see how can we try to intervene so that we don't have those long-term consequences into adulthood. Ultimately, it's a message for hope for families, but that is a process in and of itself. I mean, Montreal is considered the world's epicenter for pain, medicine and research. So we really are well positioned to do a lot of this education that we're speaking of to primary care physicians and to schools, because as Rebecca had shared, pain is gray. Sometimes you can see it physically, but a lot of times you don't, because kids learn how to deal with it. And so we want to sensitize families and extended families, teachers, coaches, principals, to be able to spot it the way that we can spot it, so that they have kind of a community around them that can support them And that can veer us away from feeling alone. No one understands me. It's not going to get better. I don't have hope for the future. So all of that is really how we look at this issue.
Let me ask you, from your perspective as a social worker, what would be your top 3 pieces of advice that you could offer to parents in particular, either before their child is diagnosed or after, in terms of how to manage something as you describe is so gray and so hard to see for the average person? What kind of advice would you give them?
I think parents need to remember that they're driving the seat, kids are in the back seat. As long as the child's under their care, they are primarily responsible. If something doesn't feel right, seek help for it. Physicians are in a position to be able to help with this kind of thing. People want to help, and there is help available. And so, if you're seeing that this is becoming a chronic issue, to advocate for your child, there's a huge role for parents to advocate for their kids and say, listen, like, we're not feeling like we're being understood. Is it possible to refer us, to our center here at the Children's or another, CIGISTN has their own Center for Pain. We work collaboratively with the Shriners. And so there are a lot of venues of being able to get specialized pain treatment for your child. I think once they do end up in a center where they're picked up by a multidisciplinary team, to really trust the team. We know what we're doing. We've seen a lot. We know what works. Of course, it's always pivoting and seeing what should be kind of tailored specifically to the patient. But it can be very easy for families to be mistrusting, just because, as I had shared earlier, they come to this point and they're thinking, how in the world are you going to help us after so many shut doors? But to really have as much as possible an openness to trying new things, thinking outside of the box. And the third piece, which is, I think a huge point that we share in our parent group, is that parents are mirrors to their kids. Whether or not you've got, your stubborn 15-year-old sassy girl, they love their parents and they trust their parents at the end of the day. And so how a parent engages in collaborating with us, in seeking, asking questions, thinking outside of the box, trying new things, kids will have more tendency to trust if their parents are trusting. And so just recognizing that mirroring impact, that they're watching you. And so your responses are super important.
Rebecca, as a mother of 3 teens yourself, in the age group of what we're talking about here with complex pain, what advice would you offer to parents, again, either of children who have not yet been diagnosed or who have been diagnosed, in terms of how best parents can support them?
Yeah, so I think the first thing before they've been diagnosed and also after, trust your instincts. If you're feeling uncomfortable with something, if you feel like something's not quite right with your child, 99.9% chance you're right, or at least it deserves some further clarification and just some help from the outside. So don't doubt yourself. This is a time when teens are really good at helping parents to feel that we're not needed and that we're, sort of a little bit dispensable. So just keep in mind, and I think that's kind of to Bethany's point as well, that you are not at all like probably in the dark about your child, that you know your child best, and just to trust your instincts. And then the second thing I would say also sort of echoes what Bethany was saying. And as a parent, I think, when we see our child in pain, we worry about it, right? And that worry can translate into different reactions. And this is where Bethany's, what she was saying about mirroring comes in. And I know certainly I have a lot of conversations with parents on the phone who are calling and they're really, really worried. First of all, I want to say that's normal. Second of all, and this is where the mean nurse in me comes out, if your child sees that, it's really not helpful. And there are really good, solid studies that show that actually, you know, parent catastrophization, which is what we call it, is linked to like higher pain experience in the child. So for parents, I would say, you know, if you're in a situation, and this can go across, you know, different chronic illnesses, but, you know, certainly in complex pain, if you have a child who's got ongoing pain and you're not coping well, then we would really recommend that you get, you know, that you make sure you've got your own supports to help you manage your anxiety and worry around the pain, to help you to be able to be that parent that you are, that wonderful parent you are, you know, that wonderful support, that rock for your child, you know, and to provide all the support that they need.
There is so much information in what you both shared. Rebecca Pitt, clinical nurse, and Bethany Frank, social worker, both with the Montreal Children's Hospital, discussing complex pain. Thank you both so much for your time today.
Thanks for having us.
Thank you, Lianne.